webinar. Today we're going to be looking at trying to understand what is anxiety. So, what is anxiety? Is it a feeling? Is it a thought? Something that goes through our mind? Or is it a behavior? So have a think about this for a moment. Is anxiety just a feeling? Or is it something to do with the way we think and perceive? Or is it something to do with the way we behave? Or is it something to do with all three of those things in combination? So have a think about it for yourself. How would you answer the question, what is anxiety? What is anxiousness? What does it mean when somebody says, I'm feeling anxious or I felt anxious? Is it the same as somebody suffering from an anxiety condition? What do you think? Is it the same or is it something different? What about feeling worried? How many of us feel worried about something? What about feeling nervous? If you have a job interview, you feel nervous. Is that anxiety or is that something different? Other similar emotions that we might use to describe anxiousness, anxiety could be feeling fearful, feeling scared, feeling concerned, or having a sense of dread. The sense of dread before going to work on a Monday morning. Again, I just want you to have a think about this. Is it the same as feeling anxious? Or is it suffering from an anxiety condition? So anxiety is a mental health condition. In fact, it's like a common cold. So think about it this way. How many people do you know that have suffered from a common cold? Anxiety is a common mental health problem. So we would say it's similar to having a common cold. However, if it goes on for too long, it is something that needs to be treated. So if you had a cold, if you had a chest infection, if the cold symptoms went on for more than 2 weeks, 4 weeks, something like that, I would generally think more than 2 weeks, not that I'm a medical doctor, but if it went on for more than 2 weeks, the chesty cough, you might need to get it checked out to avoid it developing into a long-term health condition or something more serious like bronchitis. Yeah, so anxiety is a common condition. One of the ways to think about anxiety is when it's something excessive, when the fear is excessive, when the fear is uncontrollable. But it's a fear. Anxiety is another word for fear. But it becomes a condition when it's excessive or uncontrollable. Why does this happen? Because your brain is convinced that there is a danger or a threat in your immediate surrounding or environment. That's why we get anxious. That's why people suffer with anxiety. Your brain is convinced, it perceives there to be danger or threat in your environment. Why does this happen? Why does the brain detect danger in that way? Because your brain's ultimate job is to keep you alive. Your brain doesn't care what kind of job you do, whether you get married, whether you're single, whether you're man or woman. Your brain doesn't care about any of those things. Your brain only cares about one thing, which is to keep you alive. So it's a survival mechanism. That's why your brain will always look out for danger. And when that survival mechanism or that part of the brain is turned on, you have gone into protection mode. In other words, instead of thriving, living your life, making the right decisions, thinking logically, you have gone into survival mode, which is fight, flight, or freeze. So what are we saying? When your brain detects danger, whether correctly or incorrectly, your mind and your body will go into flight, fight, or freeze mode in order to survive, in order to get away from the danger. So you can imagine, you might run away, you might fight the threat, or you might freeze. All of these are automatic survival mechanisms. So anxiety is an umbrella term. There's a wide range of psychological conditions that fall under the term anxiety conditions. For example, I'm going to give you some examples here. The body dysmorphic disorder. This is when somebody excessively, uncontrollably worries about a particular part of their body. It gives them extreme anxiety. It affects their behavior and the way they feel about themselves. It might mean that they avoid social gatherings. It might mean that they avoid getting into an intimate relationship. So this is a common mental health condition under anxiety conditions. Another one, anxiety attacks. Anxiety attacks are not the same as panic attacks, but it's essentially when your brain goes into fight and flight mode and your body feels some of those sensations associated with fight, flight, or freeze. So things like hyperventilation, sweating, increase in your heart rate, shallow breathing, tunnel vision, so on and so forth. And that goes on for more than a few minutes. Generally, we would say 20 minutes or so is how long an anxiety attack would last in a healthy body. But it's not the same as panic attacks. So what does that mean? When we treat anxiety conditions, such as anxiety attacks, they are actually viewed differently from panic attacks. Generalized anxiety disorder is a very common anxiety condition. And if I give you quick examples, it's when somebody's anxiety, that uncontrollable, excessive fear, is triggered by almost anything. And the person worries excessively about how this is going to affect them. So if I continue to worry like this, oh my God, I'm going to lose my mind. Oh my God, I'm going to go crazy. These are often symptoms of generalized anxiety disorder, very closely linked to other anxiety conditions as well as stress, burnout, and overwhelm. Health anxiety, previously known as hypochondria, is also a form of anxiety that falls under anxiety conditions when somebody is excessively, uncontrollably, irrationally even, worried about either having a health condition or developing a medical health condition. And again, it impacts on their functioning. It impacts on their ability to get on with day-to-day life. Therefore, it's excessive. It's not just feeling anxious, it's having an anxiety condition, and that is health anxiety. Obsessive compulsive disorder. I'm sure many of you guys have heard of this one. A lot of people say, yeah, but that's my OCD. I'm a little bit OCD with this thing. We're talking about OCD in a clinical setting where this actually impacts on your relationships. It impacts on your day-to-day functioning. So if I give you examples here, it takes somebody 20 minutes to leave the house because they have to check all the doors and windows, or they have to touch the knobs on the cooker to make sure it's all turned off. Anything like that is obsessive, and it's compulsive. They can't help themselves. That is also an anxiety condition. So not to be confused with people who are very particular and like to have things in a certain way. This is when it's actually excessive and it's impacting on their relationships or their day-to-day functioning. Moving on, panic attacks. I mentioned it earlier on. It is different. How is it different? Excuse me. So panic attacks without agoraphobia. So panic attacks are when somebody believes that they are in imminent danger. They're going to die. They're in medical danger. Often in anxiety attacks, a person doesn't believe they're in medical danger. They know it's anxiety. They don't believe they're in any kind of imminent medical danger. So that's the difference. One of the differences between anxiety and panic attacks. We've put down without agoraphobia. So sometimes these people people who suffer with panic attacks don't necessarily have to be outside the house. They could be indoors. It can happen whilst they're lying down. It could be whilst they're in a work presentation that they start to notice that panic attack. So it can happen in various situations. They're probably not great examples I've given you, but it's not necessarily to do with every time they go outside, because that's a different kind of anxiety condition altogether. Panic disorder, again, panic attacks, panic disorder, very closely connected but very different. So panic disorder is when somebody has an excessive fear, uncontrollable fear of having a panic attack. Maybe they've had it once in the lift, and now they're worried, if I go into a lift again, I'm going to have another panic attack. If I drive, if I'm on the motorway, if it's too busy, I'm going to have a panic attack. That's panic disorder, a fear of having panic attacks. post-traumatic stress disorder, again, you know, a lot of people have heard of this one. It's often to do with trauma. So we often see people in the clinical setting who might have come from a war-torn country. They might have unfortunately experienced or witnessed abuse, physical trauma, and a whole range of horrific, you know, circumstances. And what that then does is it triggers that panic attack, that anxiety attack, that extreme fear. So in the clinical world, when we talk about PTSD, trauma is an experience whereby the person at the time of the incident believed their life was in danger. So they're fearful of their life. Or a person witnesses somebody else's life is in danger. So what does this mean? Trauma in the clinical world is when you have experienced something that is life-threatening, or you have witnessed somebody else's life being in danger. In today's time, especially on social media, you will hear a lot of people say things like, I was traumatized in my relationship, there was a lot of trauma growing up. Yes, they're probably referring to some form of abuse. But here, what we're talking about specifically, post-traumatic stress disorder, is when somebody believes their life is in danger, or they witness somebody else's life being in danger. Moving on. So I've got a question for you guys. What is stress? What is burnout? What about work-related stress? What about relationship-related stress? Is that feeling anxious? Is that an anxiety condition? Have a think about it. So stress and burnout, these are common symptoms, these are common feelings. Work-related stress, relationship stress. They are linked to anxiety in that it can lead to, if these things are not managed, long-term, they can lead to a form of anxiety. So it's key to remove burnout, reduce stress, problem solve work-related or relationship-related stress. Specific phobias that also comes under anxiety, such as acrophobia, when somebody has an extreme reaction to heights. So I'm just going to quickly give you some examples, guys, of specific phobias, and I hope this helps. Agoraphobia, I mentioned it earlier on, it's an extreme reaction, fear to being in public space or a public space. Arachnophobia, an extreme fear of spiders. Very, very common. We often get people say, I have a fear of spiders, I have arachnophobia. Now, you won't normally, from my experience, and guys, all of this training that I do, this is based on my experience, both personal and mainly professional, working in the field of mental health for over 20 years. So I often get clients who say, well, I have arachnophobia, but it doesn't affect me. It's not really a condition that needs to be treated. If you're living in an environment, I don't know, Australia, let's say, you work in the zoo and you have a fear, you have arachnophobia, you might need to get that treated in order to be able to do your job. Again, extreme fear of heights. A lot of people have that fear, but unless it's impacting on your day-to-day functioning, it's probably not something that you're going to get treated for, because it's not affecting your day-to-day life. So moving on, claustrophobia, this is a common one. It's an extreme fear of confined space, such as being stuck in a lift or being stuck in a room and having a fear that the person cannot escape or get out. Very commonly, so thinking about some of the examples I've had, some people avoid going to festivals or theatres and cinemas because there's a fear of being stuck and not being able to escape if they need to, so not being in control of the environment. Claustrophobia, claustrophobia. Cynophobia, entomophobia, gamophobia. Any other ideas what these are, guys? So, I'm not going to go through each of those, but I just want to give you an example of how we do treat conditions such as specific phobias. Gynophobia, hypengyophobia, pedophobia. So, pedo comes from the word pediatrics, so a fear of children. Androphobia, so many specific phobias here. So again, I'm not going to go through each of those, but I hope you get the idea that we're talking about a clinical condition that actually impacts on people's day-to-day life, and that's when it would be treated. So anxiety is a common condition, as I mentioned. It's like a common cold. You can suffer from anxiety, or someone you know might suffer from mild anxiety, moderate anxiety, or severe anxiety. The severity will determine the number of sessions in therapy and the kind of work somebody does. Okay, so if I give you examples here again, somebody who suffers from mild anxiety might have something along bi-weekly 6 to 8 sessions to overcome that condition. Somebody with more severe anxiety, it could be anything between, around 12 to 15 sessions. PTSD, again, this is all based on my experience. Typically, someone with PTSD diagnosis is probably looking at anything between 15 to 20 sessions of therapy. So severity is key for the diagnosis and the treatment plan. We also, when we do the assessment, we want to understand what's the impact this condition is having on your day-to-day life. As you can imagine, if the impact is quite low or minimal, that person probably doesn't need too many sessions or weekly intensive therapy sessions. Whereas if it was impacting on their ability to go to work, sustain relationships, they might have more sessions. There might be a combination of different therapeutic models that they use, cognitive behavioral therapy, and amongst some of those. Some people, and it's very common, that they'll experience one form of anxiety, but maybe another one as well. So, for example, you might have OCD as well as health anxiety. I've often seen clients who would have all three of those. So very, very common. If you have one anxiety, that you might develop another one. Treatment, however, the number of sessions, the kind of work you do will be different for each of those anxiety conditions. So the treatment for social anxiety is nothing like the treatment for PTSD. The treatment for PTSD is nothing like somebody who suffers with generalized anxiety disorder. So treatment is very different for each anxiety, and some of the tools and techniques can overlap. In therapy, we assess for the anxiety condition, so we need to know which one it is. Even if somebody has more than one, the key thing is we help the client and we work collaboratively to find out which is the main anxiety that they're suffering from, because that's the one they're going to get the treatment planned for. And the idea is if we treat the main problem, then it will have a positive impact on the other ones anyway. So the treatment plan, the number of sessions, the duration of the sessions, again, also vary depending on the type of anxiety condition. On average, PTSD, as I mentioned, the treatment could be anything around 15 to 20 sessions. For mild anxiety, again, some of this is repeat, guys, it could be 6 sessions, and probably not weekly, probably more bi-weekly, because that's the level of support the person needs. Only clinical professionals are trained to assess somebody for a clinical condition, such as anxiety conditions, and only clinical professionals are trained, licensed to treat the condition. I do want to make this point really clear, in that I see a lot of things on social media, and I'm sure you guys do as well, where people will talk about treating or helping you with your negative thoughts, your anxiety, your condition, or they actually don't use the word condition, but they'll talk about how they want to help you with your anxiousness or if you suffer with anxiety, but they're actually health coaches. So this is what I want to highlight here. You have to be a licensed and a clinical professional, either a psychologist or a psychotherapist, to be able to assess and treat somebody who suffers from a mental health condition such as an anxiety condition. Okay, so I hope that is clear. You should not be seeing a health coach if you have been diagnosed or if you suspect you might have an anxiety condition. Why is that important? Because the clinical professionals are always under strict guidelines, and they have to undergo regular supervision to ensure that the treatment you're having, everything that's being said in the therapy room, is actually evidence-based, and it's actually under the guidelines of the work that we do. So in this regard, we're talking about NICE guidelines. So it has to be appropriate to the training, and it has to be appropriate to the evidence-based practices. So what could a treatment look like? Again, these are all my examples of the work I've done. Somebody with panic attacks will probably undergo behavioural therapy. In my private practice, I have worked with clients who have panic attacks when they go into the London Underground. So behavioural therapy would mean that we support the client when they're ready to. So this isn't the first session or the second session. There's a lot of work that's happened, a lot of groundwork that's gone in before we help the client to go into a tube station in the London Underground and overcome that panic attack. So that's an example. With panic attacks, we do behavioural therapy. We help the person through exposure therapy to overcome that excessive and uncontrollable fear that triggers the panic attacks. Somebody with OCD, I've done home visits for clients who have OCD, and in extreme cases, I've worked alongside social services staff with patients with severe OCD conditions. So here I'm talking about hoarding, where the client had like a shocking amount of newspapers in their kitchen, and literally from floor to the ceiling, the entire kitchen, in fact the living space as well and the bedroom was covered in newspaper. So it was a mammoth task, and when the client was ready to, we did actually request the support of social services. But again, once they'd done the psychological treatment, when they were ready to, that's when we got the social services to support us with that anxiety condition. PTSD sessions can be 1.5 hours to 2 hours long. Normal therapy sessions are 50 minutes, to an hour typically. So you can see in PTSD, again, it varies, it's slightly different. In the case of severe depression, guys, apologies, I can't get my words out. In the case of severe depression, I'm not talking about anxiety conditions, this is just an example. Sometimes I might see clients twice a week because it's severe depression. Severe depression with suicidal ideation, I don't actually do this in my private practice, but in the NHS, we would often work with somebody with severe depression through a multidisciplinary setup. So you'd have a group of psychologists, psychotherapists, GP, maybe even nurses assisting that particular treatment. So coming back to the earlier question, what about stress and burnout? Is it linked? Yes, it is. To remove stress and burnout, things like the quality of sleep, your quality of diet and regular exercise are absolutely fundamental. So how do we reduce stress and burnout and overwhelm so that we reduce the likelihood of suffering from anxiety? The foundational stuff, as always, is quality of sleep. Diet and exercise are fundamental for both your healthy mind and your healthy body. So it's a given that anybody with a long-term health condition or a psychological condition would always be advised to improve their sleep, diet and exercise. However, doing those three things alone would not treat an anxiety condition. Maybe if it was on a mild level, possibly, but the person with an anxiety condition who's been diagnosed would probably need to do a lot more than, improve their diet, exercise and sleep. These again are key, the foundational level support or requirements, but the person probably needs a psychological intervention as well. So it wouldn't be enough for somebody to, if they had, for example, moderate to severe anxiety, to just improve their diet or listen to mindfulness or go to the park for a walk. Again, these things are important for your mental health, don't get me wrong, but it's not really the treatment for an anxiety condition. You actually need something evidence-based, which is available in therapy. Any questions? Let us know. Now, I have a quiz for you guys. If you're watching this on a webinar, then please pause the video after each question. Which condition could the following statements relate to? The first one is, I'm going to sound stupid. So pause the video if you can, and have a bit of a think about this. I gave you a list of all the common anxiety conditions. Which one do you think this could relate to? I'm going to sound stupid. It is social anxiety. So in social anxiety, there is a fear of judgment and negative evaluation. So if I go to work, if I do this presentation, I'm going to sound stupid. Everyone's going to think I don't know what I'm talking about. They're going to laugh at me. Yeah, that's social anxiety. I can't stop worrying. I'm going to go crazy. I can't stop worrying. I'm going to go crazy. I gave you a similar example earlier on. Again, pause the video. Which one do you think this statement or fear could relate to? Generalized anxiety disorder. Next one. What if I get stuck and I can't get back home? Again, I think I've given you some examples as I went through the training, so you probably have a good idea. Agoraphobia, the fear of not being able to get out, being stuck. Agoraphobia. I'm having a heart attack, I'm going to die. Again, very, very, very frightening when somebody has this perception in their mind. Panic attack is the condition. What if I have cancer? Health anxiety. So again, all of these examples that I'm giving you, these are extreme and uncontrollable thoughts in their minds. And these people believe this is exactly what's going to happen to them. Okay, why? So go back to the earlier slides. I mentioned your brain's gone into survival mode, flight, fight, or freeze. So that's all your brain's thinking. I'm having a heart attack. I'm going to die. What if I get stuck? I won't be able to get back home. So you can see these are extreme fears, right? So naturally, the person is either going to run away, freeze, or fight, because they're so terrified. It's my fault. Why didn't I protect her? Again, pause the training. Which anxiety condition from the list I've given you do you think this could relate to? PTSD. Yeah, so somebody's life being in danger. Why didn't I protect her? My biceps are so small, it makes me look ugly. Again, pause the video. BDD, body dysmorphic disorder. This is very common. Again, everything that I'm sharing with you in this training is based on my professional experience. I've seen a lot of young men in their 20s. In their 20s, where BDD is very, very common. Also in young women as well, but I've mainly worked with a lot of guys, and so I put this down as an example. So this patient of mine was convinced he was ugly because his biceps were so small in proportion to the rest of his body. Had extreme anxiety, fear about going out. He would hide himself. Even in the summer, even in the hot weather, he would wear a jumper. He didn't want anyone to see his biceps. So we did a lot of work, a lot of behavioural work and cognitive work, looking into his mindset to try and help him to overcome this horrific condition. Here's another example. If I touch it 3 times, nothing bad will happen today. So which condition do you think this perception might relate to? Pause the video. OCD. Yeah, so the compulsion is to touch the item 3 times. And the belief is if I don't touch it, something bad will happen to me. So as you can imagine, in therapy, in psychological treatment, we're working with both the behavior, touching the item 3 times, as well as the subconscious belief system, the mindset, which is I have to touch it 3 times. So approaching it from 2 different angles, the behavior, but also the thought process. So that was OCD. Here's another one. I'm going to have another panic attack. Again, I think this one is quite straightforward. But please pause the videos, and I hope you're doing the quiz and trying to see if you can guess which perception could relate to, which particular anxiety condition. So that's panic disorder, the fear of panic attacks without agoraphobia. So this workshop is simply, this is actually part of a workshop, but this training, this webinar is simply to give you some psychoeducation. This does not mean you can go out there and diagnose other people, okay? This is simply to give you some education around what is anxiety, what does it look like, and I've hopefully given you some information for that. What does it look like? What are some of the examples? What does treatment look like in terms of therapy? And also understanding that feeling anxious or nervous, yes, they're linked to anxiety, but it's not necessarily that one has a condition that needs psychological treatment. So the severity, the impact on their lives is very, very important. So I highlight this point. This workshop is simply to give you guys some psychoeducation. Some of you guys are on this training because you're already working with me. You're a client of mine. Others have been invited to this workshop. A few will be watching this video later on as a webinar, but it's purely for your education in understanding anxiety conditions better. It doesn't train you into becoming a clinician or a therapist in any way, so please do not go and start diagnosing yourself, friends or family, because that is very, very inappropriate. But hopefully you're a bit more familiar with what happens in therapy and what it means to have anxiety. If you suspect anyone who might have anxiety, then please ask them to get in touch. Please tell them to not follow social media advice, because it can be dangerous, especially if somebody has a clinical condition and it's impacting on their day-to-day life. If they've had it for a long time, they should really be speaking to a health professional. Unless, of course, the influencer on the social media is UK trained and a licensed clinician. So I have seen 1 or 2 posts on social media, on Instagram, but they were actually qualified psychologists and doctors. So I would say that's absolutely fine, because these people are trained to only say certain things which are in line with the evidence base. Anybody else who's not trained, I would say, anything can be said because it's not regulated. So guys, just be careful. If you or anyone you suspect might have an anxiety condition, please advise them to speak to a trained health professional or a licensed clinician. If you want to get in touch, if you want to find out more about the work that I do with my clients, please get in touch. You can email me on info@rktherapy.co.uk. Equally, if you want to find out more about my actual work, please visit my website, www.rktherapy.co.uk. Now, if you are part of this webinar, I would invite you to get in touch, either through the webinar or through the email, and request a free consultation. This is not something we offer on a regular basis, but as part of this training program for the clients that I'm working with, but also others who are keen to find out more, please get in contact and book in a free consultation. I hope today's training has been useful, guys, in giving you some information on what does it mean to feel anxious versus what does an anxiety condition actually look like. Thank you for attending my webinar. Wish you all the best. Bye-bye.